I'm mad as hell. I'm mad because misinformation is putting children's lives at risk. I'm mad because history has already shown us what happens when science is ignored. And I'm mad because people who should know better are spreading fear about vaccines, fluoridated water, and public health protections that have saved millions of lives. Pause. Today I want to talk about something that affects every single one of us. The safety of our children, and how dangerous misinformation can be. This discussion is inspired by the book, Don't Let the Dr. Wakefields of the World Convince You to Endanger Your Child's Life, by David Lee Grimes. In this video we're going to talk about how misinformation spreads, why scientific evidence matters, the real history behind public health protections, and why trusting evidence can literally save lives. Because when misinformation spreads faster than facts, people get hurt. So let's talk about the science. For more than a century, governments and public health agencies around the world have taken steps to improve the safety of drinking water. Clean water is one of the most important public health achievements in human history. Before modern water treatment, contaminated water spread diseases that killed millions of people. Cholera, typhoid fever, dysentery. Entire cities used to suffer devastating outbreaks simply because their drinking water carried dangerous bacteria. So over time, scientists and public health experts began adding certain substances to municipal water supplies. Not to control people, not to experiment, but to protect communities from disease. Two of the most widely used are chlorine and fluoride. Chlorine is used to disinfect water. It kills harmful bacteria and viruses that can spread through water systems. Without it, many of the waterborne diseases that once devastated communities could return very quickly. Fluoride serves a different purpose. It helps strengthen tooth enamel and has been shown to significantly reduce tooth decay, especially in children. Both of these practices were introduced with the same goal, improving public health. Making everyday life safer for millions of people who rely on public water systems. But despite decades of research and use, these measures continue to raise important questions. Some people support them strongly. Others worry about potential risks. And in recent years, those debates have become louder, especially online. So it raises a reasonable question: should these substances remain in our drinking water? Or should individuals try to remove them? That's exactly what we're going to explore next. Because when it comes to public health decisions, it's important to look at the evidence, not just the headlines. So let's dig a little deeper. To understand why water treatment matters so much, we need to go back in time. Back to the 1800s, and the early 1900s. At that time, cities faced a deadly problem. Their drinking water could kill them. It's hard for us to imagine today, because we turn on a faucet and expect clean water. But for much of human history, that simply wasn't the case. In many growing cities, sewage systems were primitive or non-existent. Waste often contaminated rivers, lakes, and reservoirs, the very same sources people used for drinking water. And that created the perfect environment for deadly waterborne diseases. Diseases like cholera, typhoid fever, dysentery. These weren't rare illnesses. They were constant threats. Entire communities could be hit by outbreaks, and once the disease entered the water supply, it could spread incredibly fast. Children were especially vulnerable. Families could lose multiple children within weeks during severe outbreaks. Hospitals were overwhelmed, and doctors had very few tools to stop it. But then came one of the most important breakthroughs in public health history. Water chlorination. In 1908, the first major chlorination system in the United States was introduced in Jersey City, New Jersey. It was a relatively simple idea. Add small, controlled amounts of chlorine to drinking water to kill harmful bacteria and pathogens. At the time, some people were skeptical. But once cities began using chlorination, something remarkable happened. Diseases that had plagued communities for generations began to disappear. Typhoid fever rates dropped dramatically. Cholera outbreaks became increasingly rare. And one of the most important changes of all, child mortality began to fall. Children who might once have died from contaminated water were now surviving. And the impact was massive. Researchers later estimated that clean water improvements, including chlorination, accounted for nearly 43% of the decline in mortality in the United States between 1900 and 1936. Think about that for a moment. Nearly half of the improvement in survival during that period came from safer water. Not from new drugs, not from advanced surgeries, but from something as simple and powerful as clean drinking water. That is an enormous public health impact, and it shows just how important evidence-based public health decisions can be when they are done right. One of the most important figures in understanding how diseases spread through water was a British physician named John Snow. And his story changed public health forever. Back in the 1800s, most doctors believed disease spread through something called miasma, basically, bad air. If a place smelled foul, people assumed that smell itself caused illness. So when epidemics struck, cities tried to clean the air. They burned chemicals in the streets. They covered foul odors, but the diseases kept spreading. Snow wasn't convinced. He had a different idea. He believed cholera wasn't spreading through the air at all. He believed it was spreading through contaminated drinking water. At the time, this idea was controversial. But then in 1854, something happened that gave him a chance to test his theory. A deadly cholera outbreak struck the Soho, London area. People were dying rapidly. More than 500 deaths occurred within just days in a small neighborhood. Snow decided to investigate. Instead of guessing, he started collecting data. He went door to door. He studied death records. And then he did something revolutionary. He mapped the locations of the people who had died. When he looked at the map, a clear pattern appeared. Almost all the deaths were clustered around a single public water pump on Broad Street Pump. The closer people lived to that pump, the more likely they were to die from cholera. Snow took this evidence to local officials and made a bold recommendation. Remove the pump handle. If people couldn't draw water from the pump, the disease might stop spreading. Officials were skeptical, but they agreed to try it. So the pump handle was removed. And soon after, the outbreak began to fade. That moment became one of the earliest and most famous examples of modern epidemiology, the science of tracking how diseases spread in populations. Snow's work showed something incredibly important. Data can save lives. By identifying the true source of an outbreak, public health officials can stop it. And over time, Snow's research helped prove a principle that we now take for granted: clean water saves lives. It helped pave the way for modern sanitation systems, water treatment, and the public health protections that billions of people rely on today. And that brings us back to the bigger question. When scientific evidence clearly shows something protects public health, what happens when people stop trusting that evidence? Today, chlorine remains the most widely used disinfectant in drinking water systems around the world. And for a simple reason: it works. In the United States alone, more than 98% of public water systems use chlorine-based disinfectants to keep drinking water safe. That means when you turn on the tap in most homes, schools, and hospitals across the country, the water you're drinking has been treated to kill harmful microbes before it ever reaches you. Why is chlorine used so widely? Because it's extremely effective at destroying dangerous pathogens that can spread through water systems. Pathogens like E. coli, cholera bacteria, viruses that cause serious gastrointestinal illness, and even certain parasites that can make people severely sick. Without disinfection, those organisms can move quickly through water systems and infect large numbers of people. And history has shown us exactly what happens when water treatment fails. One powerful example happened in the year 2000 in the small town of Walkerton, Ontario, Canada. A contamination event allowed dangerous bacteria to enter the town's drinking water supply. The result was devastating. Thousands of residents became ill. Several people died, and many others suffered serious long-term health complications. Investigations later showed that failures in water monitoring and treatment allowed the contamination to spread. It was a tragic reminder of something public health experts have known for a long time: safe drinking water cannot be taken for granted. It requires constant monitoring, it requires proper treatment, and it requires systems that can stop dangerous pathogens before they reach the public. That's why many public health experts still believe chlorine plays an essential role in protecting communities today. Because when it comes to drinking water safety, prevention is always better than trying to control an outbreak after it starts. Even though chlorine has saved millions of lives by keeping our water safe, it isn't perfect. No public health intervention ever is. When chlorine is added to water, it does exactly what it's supposed to do. It kills harmful bacteria and viruses that can make people sick. But chemistry is complicated, and when chlorine reacts with organic material that's naturally present in water, things like decaying plants, soil particles, or other natural compounds, it can form what scientists call disinfection byproducts. One group of these byproducts is known as trihalomethanes, often shortened to THMs. These compounds have been studied for decades because scientists want to understand whether long-term exposure could have health effects. Some studies have suggested possible associations between long-term exposure to higher levels of these byproducts and certain health risks, including bladder cancer, rectal cancer, and in some cases, respiratory irritation. In addition to those long-term concerns, some people also notice more immediate effects from chlorinated water. For example, some individuals report eye irritation, dry skin, or a strong taste and smell in the water, especially if chlorine levels are higher than usual. Anyone who has opened a tap and smelled that familiar, pool-like odor knows what that can be like. So yes, there are trade-offs. And scientists take those concerns seriously. Water treatment standards are constantly reviewed and updated to keep these byproducts as low as possible while still maintaining protection against dangerous pathogens. That's why regulatory agencies set strict limits on how much chlorine and how many disinfection byproducts are allowed in public drinking water. And after decades of research, most public health experts agree on one important point. At the levels used in regulated water systems, the benefits of chlorine far outweigh the risks. Because without disinfection, the risk of deadly waterborne disease rises dramatically. So the real challenge isn't choosing between perfectly safe water and treated water. The real challenge is finding the safest balance, protecting people from infectious disease while minimizing any potential long-term chemical exposure. And that balance is something scientists continue to study and refine today. Now let's talk about the second major additive in public drinking water. Fluoride. Fluoride was introduced into water systems for one main reason: to help prevent tooth decay. And the idea behind it actually came from a surprising observation more than 100 years ago. In the early 1900s, dentists working in certain regions of the United States began noticing something unusual. In communities where the natural water supply contained higher levels of fluoride, many people had stained or mottled teeth, a condition that later became known as dental fluorosis. At first, dentists were concerned, but as they looked more closely, they noticed something unexpected. Those same people had far fewer cavities than communities with little or no fluoride in their water. That observation caught the attention of researchers. Scientists began studying what was happening inside the teeth themselves. And eventually they discovered that low levels of fluoride help strengthen tooth enamel, the protective outer layer of the tooth. Stronger enamel means teeth are more resistant to the acids produced by bacteria in the mouth. In simple terms, fluoride helps teeth fight off decay. Once researchers understood this connection, public health officials began exploring whether adding small, controlled amounts of fluoride to drinking water could help protect entire communities. The first large community water fluoridation program began in Grand Rapids, Michigan in 1945. Scientists carefully monitored the children growing up in that city, and the results were dramatic. Over time, children experienced about a 60% reduction in cavities compared with communities that did not fluoridate their water. That's a huge difference, especially for families who couldn't always afford regular dental care. Because tooth decay isn't just uncomfortable, it can lead to infections, pain, missed school days, and expensive dental procedures. So fluoridation quickly spread to other communities. And today, roughly 72% of Americans who use public water systems receive fluoridated water. It's considered by many public health experts to be one of the most effective and affordable ways to prevent tooth decay across entire populations. Now before we go further, quick pause. If you appreciate conversations that actually dig into the history and science behind public health issues, take a second to hit the like button. It really helps this video reach more people. And if you want more evidence-based discussions like this, about vaccines, public health, and medical misinformation, make sure you subscribe. Because the next part of this discussion is where things get interesting. Fluoride has been widely praised for reducing cavities, but it has also become one of the most debated topics in public health. So next, let's talk about why. So how exactly does fluoride help protect our teeth? The science behind it is actually pretty straightforward. Research over many decades has shown that fluoride can reduce tooth decay by about 25 to 50% in both children and adults. That's a huge impact for something most people don't even think about when they turn on the tap. Fluoride helps protect teeth in several important ways. First, it strengthens tooth enamel. Enamel is the hard outer shell of your teeth. It acts like armor, protecting the softer layers underneath from acids and bacteria. Fluoride helps make that enamel stronger and more resistant to damage. Second, fluoride helps rebuild minerals in the teeth. Throughout the day, our teeth constantly lose and regain minerals. When we eat sugary or acidic foods, minerals can be stripped away from the enamel. Fluoride helps the enamel pull those minerals back in and repair itself before cavities can form. And third, fluoride helps slow down the damage caused by bacteria in the mouth. The bacteria that live in dental plaque produce acids that slowly eat away at tooth enamel. Fluoride helps weaken that process, giving teeth an extra layer of defense. But the benefits aren't just about healthier teeth. Fluoride programs are also considered extremely cost-effective from a public health standpoint. Studies have shown that for every $1 communities spend on water fluoridation, they save roughly $20 in dental treatment costs. Think about that for a moment. Less tooth decay means fewer fillings, fewer dental surgeries, fewer emergency dental visits, and fewer missed days of school or work due to dental pain. So when public health experts talk about fluoridation, they often point to two big advantages: better dental health and lower healthcare costs. But despite these benefits, fluoride remains one of the most debated public health policies today. And that raises an important question. If the benefits are so well documented, why do some people still strongly oppose it? That's what we're going to explore next. Like chlorine, fluoride has clear benefits, but it also raises important questions. And those questions are part of why the debate around fluoridation continues today. At the levels currently recommended for public water systems, about 0.7 milligrams per liter, most large studies have found fluoride to be safe for the general population. These levels are carefully chosen. They are high enough to help prevent tooth decay, but low enough to avoid most of the known risks associated with higher exposure. Still, like many substances in medicine and public health, the key issue is dose. Too much of almost anything can become harmful. And fluoride is no exception. One of the most commonly discussed effects of higher fluoride exposure is dental fluorosis. Dental fluorosis doesn't usually damage the teeth themselves, but it can change the appearance of the enamel. In mild cases, it may appear as faint white streaks or spots. In more noticeable cases, it can cause discoloration or uneven patterns on the teeth. This typically happens when children consume too much fluoride while their teeth are still developing. At much higher exposure levels, far above what is normally found in regulated drinking water, another condition called skeletal fluorosis can occur. Skeletal fluorosis affects bones and joints. It can cause stiffness, pain, and in severe cases changes in bone structure. However, this condition is extremely rare in countries with regulated water systems because fluoride concentrations are tightly controlled. Over the years, some studies have also raised questions about other potential health effects when fluoride exposure becomes very high. These concerns have included possible links to reduced IQ in children at high exposure levels, thyroid function changes, and stress on the kidneys in people who already have kidney disease. Because of these concerns, scientists continue to study fluoride carefully, but many public health experts point out an important detail. Most of the research that finds these potential risks involves fluoride concentrations much higher than those used in public drinking water systems. In other words, the effects being studied often occur in regions where fluoride levels are naturally very high, or where water is not carefully regulated. And that's why the debate continues. Some people focus on the proven benefits of cavity prevention. Others focus on the potential risks if exposure becomes too high. So the real question many communities continue to ask is this: how do we balance the benefits of fluoridation with the need to minimize any possible risks? That's where the conversation around public health policy becomes both complex and important. Some communities have actually decided to remove fluoride from their water, and the results have been telling. For example, studies in cities like Calgary and Juneau found that once fluoride was taken out of the water supply, cavity rates started climbing again. Not by a little, by a noticeable, measurable amount. Experts estimate that if fluoridation were eliminated nationwide, we could be looking at millions of additional cavities, billions of dollars in extra dental treatment costs, and the impact wouldn't be evenly felt. Families with lower incomes, who often have less access to regular dental care, would be hit the hardest. Children in these families could face pain, infections, and missed school days. Parents would have to spend more on dental care that could have been prevented. It's a stark reminder that public health measures like fluoridation aren't just abstract policies. They directly affect real people, their health, their finances, and their quality of life. So when communities debate whether to remove fluoride from water, they're not just talking about taste or personal preference. They're talking about preventable disease, cost, and equity. And that's why experts stress the importance of looking at the evidence carefully before making decisions that affect millions of people. If you're finding this breakdown eye-opening, go ahead and hit the like button. It helps this video reach more people. And if you want to stay updated on discussions like this about public health, science, and evidence-based policy, make sure you subscribe so you don't miss future videos. Now, some people might prefer to avoid chlorine or fluoride in their personal drinking water. And that's okay, there are options for individuals who want more control over what's in their tap water. One popular choice is activated charcoal filtration systems, like Berkey filters. These filters are designed to remove things like chlorine, fluoride, certain other contaminants, all while still keeping the water flowing safely from public water systems. That's an important point. Using personal filtration doesn't interfere with the safety measures that protect everyone else in your community. It's a way to take personal choice and public safety and make them work together. So if you're concerned about taste, odor, or just want extra peace of mind, filtration can be a practical solution. And as always, if you find this information useful, hit the like button. It helps get this video in front of more people. And make sure you subscribe if you want more evidence-based insights into public health, science, and everyday decisions that affect you and your family. One important principle applies here, one that goes far beyond just water treatment. Everything in life comes with risks and benefits. Nothing is perfectly safe. Nothing is perfectly risk-free. Take chlorine, for example. It has literally saved millions of lives by preventing deadly waterborne diseases like cholera, typhoid, and dysentery. And fluoride? It has dramatically reduced tooth decay, especially in children, preventing pain, infection, and costly dental procedures. At the same time, both chlorine and fluoride come with legitimate concerns. Disinfection byproducts, dental fluorosis, and debates about long-term exposure. These are not imaginary issues. They are real, and they're still studied today. So the key question becomes this: who should decide? Should it be the government, making these choices for the entire population in the name of public health? Or should individuals have more control over what's in their drinking water? There's no simple answer, but it's a conversation worth having, because it touches on health, safety, and personal choice all at once. And if you're interested in diving deeper into these kinds of debates, hit like so more people can join the conversation. And don't forget to subscribe for more evidence-based discussions about public health, science, and decisions that affect your daily life. Water treatment is truly one of the greatest public health achievements in history. It's saved millions of lives, prevented countless outbreaks, and made modern cities possible. But the debates around chlorine and fluoride also show us something important. Even the most widely accepted public health measures come with complex decisions, trade-offs, and ongoing discussions. That's why it's so important to understand the science, the history, and the risks and benefits of these interventions. Because when we understand the evidence, we can make informed choices, both as individuals and as a society. And here's the thing: being informed doesn't just protect you, it protects your family, your community, and future generations. If you've found this video helpful so far, hit the like button. It helps more people see this important discussion. And don't forget to subscribe for more deep dives into public health, science, and the stories behind the decisions that impact our everyday lives. Next, we'll look at how similar debates play out with other public health topics, and why staying informed is more important than ever. If you want to go deeper into this topic, beyond what we could cover in one video, there's a resource worth checking out. The book is called "Don't Let the Dr. Wakefields of the World Convince You to Endanger Your Child's Life" by David Lee Grimes. It takes a much deeper dive into the issues we talked about today, including the history of public water treatment, the scientific studies behind chlorine and fluoride, real-world examples from around the world, and the broader impact these decisions have on public health. If you're someone who likes to look at the data for yourself, if you want more context, more detail, and more evidence, it's definitely worth a read. You can find it on Amazon. I'll include a link in the description below so you can check it out for yourself. And if you do read it, come back and let me know what you think, because these are conversations that matter, and they're not going away anytime soon.